Tonight we have a special report on the problem of getting good health care in rural Minnesota and how the state's revolutionary new program to enhance health care access may actually be making problems worse in small towns.
Robin, since 1981, 15 hospitals have closed in small towns in Minnesota, and not a single new one has opened. Starting next year, the new health right law will put a 2% tax on all hospitals and doctors in the state. In rural communities throughout the state, they fear that will be the final nail in the coffin. To find out just what the problems are facing small-town doctors and hospitals, we went to Canby, Minnesota. It's a town of about 1,800, just a few miles from the South Dakota border. The kind of place where doctors take the time to really get to know their patients. At least, that's the way it has been.
How are the twins doing?
Yeah, they just tied it up. I think it's too short.
We'll get to the important things first. Let's see your pictures.
And that's my neighbor.
Born, raised, and educated in Minnesota, for Dr. Christopher Tashjian, coming to practice in Canby was a dream come true. A small town with a hospital where he could be a surgeon, deliver babies, practice the full scope of medicine. He has been here for 4 years, working with 2 other doctors, both in their 60s and nearing retirement. There is so much work, they need a 4th doctor, and for 4 years they've been trying to recruit one with no success. It was that search, Dr. Tashjian says, that made him realize his dream was becoming a nightmare.
It became very clear to me that there were several obstacles to practicing out here that I didn't take into account when I initially came out here.
Kind of here, too. I get a stinging pain once, right there.
One of those obstacles is Medicare. When Clara Cleveland comes in to see how her broken leg is mending, Medicare pays Dr. Tashjian $16. But if he were 8 miles farther west in South Dakota, Medicare would pay him at least $35. In Arizona, $50. $16 paid to you here in Minnesota, $35 to $40 for the same visit in South Dakota, $50 for the same visit in Arizona. Why?
Well, that's a good question. According to the government, it costs more to practice out there. And while that may have been true in 1960 when they instituted Medicare, our costs here are now just as much, if not more. It's kind of an old system that has crept in and made it such a disparity between Minnesota and, say, the East Coast or the West Coast that it makes it very, very difficult. The thing that compounds that is that 40% of the people we see are on Medicare. You know, in a suburban area, maybe 5% of the people are on Medicare.
This one I can maybe believe that they wouldn't pay, but the venipuncture they should pay.
Medicare is starting to revise its payment schedules, but that will take time, and that is only part of the problem a small-town clinic and hospital has in dealing with Medicare. They've had to buy a $10,000 computer system and hire people to run it in order to try and meet Medicare's rules and regulations to get paid anything. It's complex and often frustrating.
Say someone came in with hypertension, but they said, oh, by the way, doc, it kind of hurts me, or they said, oh, by the way, you know, I feel like I might have a bladder infection too, and in addition to this, I got high blood pressure. So you're seeing them for 3 different things. So what we have to do is we have to put in 3 diagnoses, okay, which means you have to code it 3 separate times. Then you have to run it through a computer and says, now do all these diagnoses fit with what we did? Or is it still going to come back and say, gee, we don't think we don't think a sodium potassium for hypertension is good enough, or we don't think that that correlates whether it does or not.
That's somebody determining after they know the outcome whether
Right.
you did the thing that...
You bet.
That's got to be frustrating.
Yeah, that's real frustrating. And to be honest, and maybe this is one of the reasons why we're not as financially productive as, say, the larger clinics is the physicians here feel these are things we got to do. Whether we get reimbursed for it or not isn't the point.
And it's not just Medicare. For a small rural clinic and a hospital, it can also be very expensive to treat the very young.
Really congested in the nose, you can see that.
Because of changes in state regulations, the number of pregnant women who qualify for medical assistance has gone from 10% to 50% in Canby in the past 4 years. The idea was to get pregnant women to doctors sooner and produce healthier babies. But it's also produced a lot more red ink for small-town hospitals.
Here's an obstetrical visit for one of our patients for their hospital stay. The actual stay costs less than $2,000. Now that's considerably less than you would pay for a hospital stay in the Twin Cities. This is for delivering a baby, staying 2 days afterwards, and all the care that goes along with that. You know, $2,000 is really pretty reasonable. However, medical assistance fields, it's only worth $400. And it doesn't take a genius to figure out that if your bill's $2,000 and you're getting reimbursed $400 on 50% of your patients, it's hard to make ends meet.
It also doesn't take a genius to realize these sorts of problems are not conducive to attracting other doctors. And that creates another major problem for Dr. Tashjian and his partners: overwork.
How's your belly doing?
For example, Sunday night at 11:30, there was an emergency appendectomy on this little boy, and 2 emergency phone calls after that Dr. Tashjian handled at home. Hospital rounds started Monday morning at 7 o'clock.
Okay, we'll have you look right here now.
By 9 o'clock, he was in the clinic seeing patients until 5.
An order sheet for me?
Then evening rounds at the hospital, followed by a visit to the nursing home to discuss a possible surgery with a patient.
I don't feel like that I'll fall, but it just hurts to step on it. So
You just have very difficult disease.
It was 7 p.m. before he headed home. Then at 10:30 Monday night, another emergency brought him back to the hospital.
No, sounds like your stomach is getting kind of torn up, and the question is why. Let's wait and see what the blood work shows.
It's 16,
Right.
and it's for 16.5.
Okay. But she's all right. The hemoglobin's fine.
And he wouldn't leave until after midnight. Then at 1:30 and 4 a.m., 2 more emergency phone calls at home. And by 7 a.m. Tuesday, he was scrubbing for surgery that had been previously scheduled.
I already work somewhere between 80 and 100 hours a week. I can't work anymore.
He also can't spend much time with his family, working 80 to 100 hours a week. So Dr. Tashjian has decided the only thing he can do is leave. He's taking a job at a clinic in Wisconsin that doesn't have Minnesota's problems in attracting doctors.
If you look at the clinic I'm joining, they hired 3 new family physicians this year. I mean, that's dramatic when you look at, there's, 250, 300 spots in Minnesota alone that are screaming for family docs, and here's one clinic that can hire 3 of them in 1 year.
No one understands what Dr. Tashjian is saying better than the people in this room. They are members of Canby's Physician Recruitment Committee. They've spent $40,000 since 1990 on mailing lists to produce this brochure, an audio cassette that comes with a fishing lure, and a videotape.
In today's world, there still exist places where traditional values thrive and relaxed lifestyles flourish.
All extolling the virtues of life in small-town Minnesota. In the past 2 years, they've sent out 12,000 of these to doctors. So out of 12,000 of these, how many positive responses have you had?
We've had over a dozen responses.
12?
Right.
1 per 1,000?
Right.
But so far, not even one of those 12 has come for a visit. And that was before the legislature passed Health Right. Now they get responses like this one.
No thanks. When your legislature is done, Minnesota will have no doctors. I think Health Right was kind of just maybe the last blow.
Canby is one of scores of small Minnesota towns facing a health care crisis. Without doctors, Canby will lose its hospital, the town's biggest employer. Still, no one we talk with here blames Dr. Tashjian for leaving. They say they understand. What they don't understand is how to make any doctors feel differently. We said no one blames him, not even Drs. John Myers and Robert Olson, who are staying behind and who between them have practiced in Canby for 60 years or more. But they don't understand how to make the legislature here or the Congress in Washington understand their problems and make changes so they can attract more doctors.
It sounds like a nightmare scene from Northern exposure. People have these problems. They can't attract doctors to their small towns. What happens if they can't get doctors? What happens to local businesses there, Gary?
Well, it's a good question. In Canby, it looks like it could be a major problem for the future of the town. A number of the people we talked with that were there to see the doctor, there for treatments of one type or another, said that if they hadn't been coming to the clinic, they wouldn't be shopping in Canby. They wouldn't be buying their groceries there. Or one lady said, looking for a barbecue, as I am today, and some clothes for my daughter. We'd shop in Marshall or whatever other town we went to see the doctor in. There are several other hospitals around there. It'd be another 20, 30, 40, 50-mile drive, depending on where you live. But at least 2 of those other hospitals in western Minnesota, that part, are facing financial difficulties of their own and may not survive. Canby, at least for now, will continue But 2 doctors doing the work of 4, it's just going to get worse.
Well, you know, a consortium, some kind of idea to regulate fees for health insurance sounds like a good idea, but doctors in central Minnesota got in trouble for just doing that.
Right. Antitrust violations, the Attorney General decided for small-town hospitals to form consortiums to try and keep rates down, to try and deal with insurance companies better, to share the cost of dealing with Medicare. So they'd love to try that.
So what does the legislature
Attorney
let them
General
do,
said they can.
really? I mean,
Not a whole lot, but if you remember when Health Right was passed, Paul Ogren and others were saying, we know it's not perfect, we know it'll need to be changed. They're just hoping that now they will recognize that the rural doctors weren't just complaining. They face a serious problem and they need help.
very scary.
It
Very
is.
scary what could happen. Thanks, Gary.